My name is Laura. I am 26 years old, a certified youth peer advocate here in New York State. I'm currently working on my certified peer specialist and my certified recovery peer advocate credentials. I identify as a peer, a wife, a fur mom, and so much more. I was fortunate enough to be able to use my live experience to earn my master's degree this past year, and I'm using that degree to help others in my community live their best life. A lot of what peer support is about is how we identify, and I want to make sure that we take into account all different types of identifications for us as peers, because we're not just peers, we're so much more. So first, I wanted to start with an icebreaker. Since there are a few of us in here, we could probably just one or two people each could answer a question. But at what age do you think self advocacy starts? What does peer support mean to you? And have you noticed any changes in the way you perform advocacy throughout your career or life as you age? So we can take like a minute or two to think about those questions. If it's easier for you to type it in, that works. And then Colin can read out the answers. I just can't see anybody on my screen. So if you are waving your hand or something, I can't see it.
I was going to say something similar to what someone just put in the chat. From birth, it begins crying for food. Yeah, that's exactly what I was thinking. Like from birth
Yep.
to it comes out in different ways, but yeah.
Exactly. Yep. That's it. That's when we start. We start as young as the second we're born, really, to make sure that people understand what we need. And peer support is so much more than the service that it's developed into. It's natural. It's community engagement. It's really just being there for one another in different ways. And the way that peer support has developed throughout the years is pretty astronomical in regards to whole person community wellness. Does anybody want to answer what peer support means to them? Colin, is there anything in the chat?
No, there's nothing in the chat right
Okay.
now.
Um, so then this whole presentation is kind of going to go into what different styles of peer support could mean to other folks as you're developing in your life.
Oh,
Um,
sorry, Laura, we actually do have a couple
Perfect.
answers coming in here.
Sure.
Um, Darcel Marie said, helping people get from one step to another. Uh, Jessica Hicks said, walking alongside someone on their recovery journey, sharing experiences to support self-advocacy. And Lisa Bartles said, peer support means being open-minded and supporting others.
Yeah, that's amazing. And I couldn't agree more with all of those. Um, And the biggest thing about peer support is that it's flexible, right? It changes as we change. Our lived experience niche changes as we age too. So the type of peer support that we provide can also change as we develop throughout our career and our lives. And what that peer support looks like and means to you can change alongside with that. Has anyone noticed any changes in the way they perform their advocacy as they've gone throughout their career or life?
I mean, I think for me at certain points it was more about like directly supporting individuals, and at other points, probably more on a systemic or organizational level, advocating for change in the peer support workforce, advocating for, policy or programmatic shifts, things like that.
Yeah, 100%. For me, I think that I've been, in the start of my career, I was doing more systemic peer advocacy for young people in New York State. And now it's become more so about how the youth peer advocates and other certified peer specialists can develop into their careers over time. So even, as we make our decisions and choices throughout life, it looks different for everybody, even if we're not considering as we age specifically. Did anybody put anything in the chat before I move on?
Yeah, Jessica Hicks said, I have learned to hone in my skills more, especially in regards to communication, how to manage emotions in order to be heard.
Yeah, that's amazing. And that's a big learning curve too for his peers, especially starting out, making sure we use our lived experience in a way that's constructive and not destructive to us or the people we're supporting. So thank you everybody for participating. So let's start at the beginning. In the United States, historically speaking, peer support started around the 1960s, and that was when the people that were in these state-run insane asylums were advocating for better treatment in these facilities. They were talking about the abuse and the misuse of their services that were being provided by their doctors and physicians. And then as it progressed on to now, it's so much more than just the mistreatment that folks have or had while being in psychiatric hospitals. We became more organized. We became to really understand the importance of community connection and community networking. So in the 80s, we created different support groups, different drop in centers for these folks with this lived experience to find connected support with others that have similar lived experience. In 2007, it was recognized as an evidence-based practice by the Center for Medicaid Services. And this offers an opportunity for peers and peer support specialists alike to be professionalized, codify the different types of curriculums we have out there. In New York State, we have the Academy of Peer Services. That's the main one that we use for the certified peer specialist, but I'll talk a little bit more about that later. Being Medicaid recognized really allowed us to say, hey, we're here, our services work, and this is how they work, right? We were proving ourselves to physicians and clinicians across the states. And in 2020, the Senate passed a bill that authorized states like California to join the Medi-Cal peer support specialists. So again, another provider type for peer support. It's ever expanding. And now our advocacy efforts focuses more so on distinct peer workforce development. It's like wages, getting our services out there in different community resources and different positions like hospitals, clinics, really making sure that folks understand that they have the option of peer support if they so choose. And then, though historically peer support has focused on adults, peer support affects other parts of life too, right? So, if anybody is feeling brave enough to answer, how do you think peer support affects other parts of your life?
I think it makes me feel more open to sharing my experience with my like friends and loved ones, and it makes me feel more accountable in the ways that I show up in the world and feeling comfortable normalizing that to like the people that I have a more intimate relationship with. So I think it's been very beneficial.
Yeah. And I think it's important to mention that I'm going to reinforce this throughout the training is that peer support is such a natural thing that we do, even before we became Medicaid recognized, even before we got the recognition of clinicians and other providers. Peer support has been around forever. It's by the most simple definition, just human connection and community building. So, we do peer support as young as helping, as young as babies, as young as adolescents, just being there for one another in that capacity. And I agree that peer support has really made me more open to expressing myself when I do have those challenges, right? And being able to better help other people too around me, either professionally or personally. Peer support has impacted my life so greatly that I feel with it has made me a fuller person, right? So thank you everybody for that too.
I also think, like, even though I didn't hear about peer support until my adulthood, I mean, my hospitalizations and entry into sort of the treatment world began in middle school, and probably I should have gotten help a lot sooner than that. But I can only imagine, honestly, if I, like, with that first hospitalization, if I had had access to peer support, even on an informal level, like what the trajectory would have looked like. And I imagine it would have been quite different. That's not to say everything would have automatically stopped, but I think I would have felt a lot more engaged and trustful and less alone and hopeful and all of that.
Yeah, and a lot of peers do say that they wish they had it sooner or that it started sooner, right? Um, and part of our ongoing advocacy and involvement of peer support is making sure that that need is being met earlier, and that need is continuously being met as we progress throughout life. Because just as people age and change, so do our needs. And that's a really special thing, I think, about peer support, and how we have advocated throughout the years and how it continues to evolve with us and not necessarily against us. But is there anything else in the chat, Colin, before I move on?
Yeah, Jessica added that it makes me more vulnerable, sharing my trauma to help others. It also helps with my personal healing journey.
Yeah, that's amazing. And I agree. I think it's sharing our stories in that constructive way is healing for sure. So, how does peer support stay relevant? So, peer support is flexible, adaptable, universal, and transformative. Like I've been saying, it starts out as young as infancy and continues to go until we are elderly. And peer support is much more than just the service we're providing that's been defined by Medicaid, right? It's reaching out to people, it's connecting to others, it's really building that community based on your experiences, whatever that looks like, and this, helping others find hope in a similar way or in their own way, in their own stories, right? So being a peer supporter means that you are flexible to the needs of the person you're supporting, as they go through their different challenges or circumstances. Sometimes the service provisions have to change, and it's seen time and time again that peer support is becoming universal, right? There are studies from Australia, Costa Rica, and other parts of Europe that show the importance of peer support. It's not just a American thing or a European thing, it's everywhere. And it's evidence-based practices have shown how transformative it is. Prior to peer support, it was believed that mental people with mental health challenges couldn't recover, right? So they were going to be stuck in these clinical settings forever, or they couldn't be quote unquote productive members of society. And peer support has really shed light to clinicians and politicians that that's not really the case. People just might need different things and need that flexibility that peer support has that other services might not have. So peer support as you age. There is a QR code. It'll take you to a link called Mentimeter, and you're going to answer these two questions. So think about what your needs were when you were an adolescent. Are they the same as they are now? And do you foresee them changing as you continue to grow? So I'll give everybody a few minutes to do that. And I'm going to pull up the Mentimeter. Just stop sharing my screen for just a second. Is everybody having an okay time with the QR code and seeing the questions?
I think on mine only one question came up. Was it just one or was it two?
It's supposed to be two, but if the link isn't working, we can just have an open discussion too.
Yeah, I
Is
just saw the
anyone else
first
having that
one.
same challenge? Okay, so we'll do away with the actual Mentimeter part, but we'll just have a quick discussion. All right. Perfect. So are your needs the same now as they were when you were younger? What does everyone think about that? If you could just shout it out, how you feel.
No.
Right. I don't, mine definitely aren't the same as they were, even between last year, right? Is
Yeah, we have
anyone
a few
commenting in the
no's.
chat?
Yeah, we have a few no's in the chat.
Okay. And do you foresee them changing as you continue to age?
We have some yeses in the chat.
So as I continue with the presentation, it's going to go into more so how they change as we age too, and how peer support can meet those needs. So these are the different types of peer support: youth peer advocate, a family peer advocate, certified recovery peer advocate, and a certified peer specialist. I do want to mention that this is specific to New York State. So I don't want, I just want to make sure that everyone has that disclosure before we continue, because I'm not 100% sure what's around in other states, but hopefully soon, every state has a youth peer advocate and a family peer advocate, a certified recovery peer, and certified specialist. And these, even though they're all peers and the scope of work is different, the fundamentals of peer support remain the same. So a youth peer advocate, young people have been part of the peer support movement since the beginning, right? It's as early as the 70s and 80s, and became more organized as a movement in the late 80s. And as of 2013, it became Medicaid billable, which means that youth peer advocates can now be paid for their services, and they're being recognized as a successful part of the peer movement too. They are specifically for transition aged youth, 18 and under. So youth peer advocates have a special lived experience that stays relevant because they are younger in age. So the biggest thing with youth peer advocacy that it makes it different than, say, a certified peer specialist who focuses on people 18 and up is that their lived experience since they are younger is still relevant to the young people navigating those systems. I also want to mention that youth peer advocacy is more than just mental health. You can have youth peer advocates in juvenile justice, developmental disabilities, transitional housing, homelessness. Really, anywhere a young person is where a youth peer advocate can also be. So these are some brief job expectations of a youth peer advocate. Some of them facilitate support groups. They documentation according to the agency policy, provide mutual support through established, structured, strength-based, and equitable relationships based on their own lived experience navigating a youth serving system, provide connections to outside community resources such as youth clubs, recreational groups, and other mental health supports, and empowers families to advocate through coaching, mentoring, and modeling. So oftentimes youth peer advocates work together with what we're going to learn about in just a minute or two, family peer advocacy. And they work together because peer support is more than just focusing on the person receiving the supports. We want to focus on the whole person and the whole family unit to make sure that people are getting everything out of it that they could, right? Making sure that each dimension of wellness is being hit, making sure that the young person and the parent isn't left stranded anywhere, or felt like they're left hanging in a particular situation. So we want to make sure, well, the whole point of peer support is to make sure that everyone feels like their needs are being met. Does anyone have any questions about a youth peer advocacy or what it could look like?
I actually have a question, Laura.
Sure.
Does so obviously the word peer implies that um, it's someone kind of on the same level as you.
Mm-hmm.
That's what the special thing about being a peer specialist is like we are on this journey together. Um, is are youth peer specialists as you found? Because I haven't been a peer specialist for very long. Um, do they tend to be younger as well and have, similar experiences?
Yes, 100%. So in order
Okay.
to be a youth peer advocate, you have to be under 30. Um,
Okay.
and we want to make sure that's the age limit is there because we want to make sure that their lived experience is still relevant to the young people that are currently going through it. Systems change all the time, policies change, procedures change, right? So they, for youth peer advocates, we want to make sure that their experience still makes sense to what the young person is going through.
Thank you.
You're welcome. Any other questions? Okay. So now we're going to be talking about the family peer advocate. So, like youth peer advocates, family peer support began in the late 80s. Family peer advocates did become Medicaid billable before youth peer advocates, and that was in 1999. This service is intended for parents, either biological, adopted, or foster, of young folks with behavioral or mental health challenges. And to become a family peer advocate, you must have lived experience in navigating the system for or with your child. So that's the big distinction between this type of peer advocacy and all of the others, is that the lived experience is secondhand and not necessarily firsthand, because you are not the one needing the services, right? You're supporting your child or your guardianee for getting the supports. So that's a big distinction between the two, between all of them, actually. And again, some of the job expectations of a family peer: promote needed changes in the systems that affect at-risk parents and children, provide peer support to families, meet documentation requirements in a timely manner based on agency policy. This is the biggest one, in my opinion: empower families to advocate for family-driven care through coaching, mentoring, and modeling. Facilitate or co-facilitate meetings with families in the home, agency, or community. So family peer advocates exist in schools, exist in clinics, and exist in hospitals. Similar to how a youth peer is, wherever a family at risk could be is where a family peer advocate tries to be too. So we have, on Long Island specifically, we have family peer advocates in some of our residential treatment facilities, and that's to support the parents through their child's treatment, whether it be they had a hard time that day, or the young person is struggling with medication. How can the parent best support their child within the system? And family peer advocates are really instrumental in teaching parents and supporting parents in forming their confidence and being the number one support for their kid. The whole point of family peer advocacy is to uplift the family and to hopefully get them to not necessarily need the peer advocacy anymore, because they feel so confident in the system that they're involved in. Does anyone have any questions? I know I keep asking that. I just
I have
can't
a
see the chat.
question.
Sure.
So I know you mentioned that often family peer advocates or youth peer advocates work very closely with family peer advocates, that they work together. Would you say that there are ever situations where it's sort of separate and someone might just be engaged in family peer advocacy? Like, it doesn't sound like that would be very helpful, just as far as transparency and communication and
Right.
empowering the family as a whole. Like, is it usually more like an adjunct to youth
So
peer?
historically, family peer advocacy is the first step of peer support that these families do get. And then when the family members start understanding the systems a little bit better and they are still struggling to provide the best support to their young person, that's when the youth peer advocate comes in to provide that one-to-one. Because, the background knowledge that the family has might not be that lived experience with those mental health challenges. And that's where the youth peer advocate can say, hey, I am an expert in this field, in this realm, and I can take over this part. You just be that consistent for your child so they can get the most out of the service that I'm providing or the family peer advocate is providing. Does that make sense?
Yes, it does. Thank you.
Okay. Any other questions? Okay. So next we're going to talk about a certified recovery peer advocate. This peer support focuses on providing support to those in recovery of substance use disorders based on their own lived experience. It became Medicaid billable in 2015. And in 2019, OASAS collaborated with community agencies to two separate designations to add to the CRPA. So there's a CRPA-Y and a CRPA-F. And these designations differ by type of lived experience. So in big fancy words, it basically means that the CRPA-Y focuses on young people with substance use disorder. So similar to the Youth Peer Advocate, young people are supporting young people in navigating their recovery with substances. And the CRPA-F focuses on family members who support their family with substance use disorder. So say you have a cousin, a mother, a father, a sibling that struggles with substance use and they rely heavily on you, you would qualify for this designation for the certified recovery peer. Any questions in the chat?
No questions in the chat.
Okay. So some of the job expectations of the certified recovery peer are educating program participants about various modes of recovery while encouraging them to find what works for them, raising awareness of existing social and other support services, linking participants to formal recovery supports, and assisting with applying for benefits, going to medical appointments, and other things as needed that are specified by the agency of employment. So a certified recovery peer focuses on recovery based upon what the recipient wants and based on what the recipient defines as recovery. Recovery looks different for everybody, right? Sometimes it's complete sobriety and abstinence. Sometimes it's harm reduction, choosing things that are safer to use or using less, right? Recovery is very different depending on who's looking at it and who's trying to tackle it on. And being a certified recovery peer advocate has become such a big thing, especially nowadays with the opioid epidemic, fentanyl, making sure that folks understand the risks when they are using on the street and providing them the tools so they can test the substances that they're using with test strips, finding different ways of harm reduction, whether it's using less. There are services, one specifically called Brave, and that app allows you as a volunteer to support somebody who's actively using. So you register as a volunteer, and the person on the other side of the line will be using their substance of choice. And you really just hang out with them for about an hour, 30 minutes to make sure that they don't overdose. And God forbid they do, you are the person that could connect their phone to an emergency line. So that's another service that New York provides. I'm not sure if they have similar things like that across the country. Does anyone have any comments or questions? Okay. So the last type of peer specialist in New York State is the certified peer specialist. It began in the 70s, but again, it was seen as early as the late 1800s in Europe. And this was done by a doctor in France named Dr. Baptiste Jean Poussin. And he was the first doctor on record to see the value in peer support and lived experience. So he would hire his previous patients to help his newer patients along their journey of recovery and had them employed within the hospital system. So that was something interesting and really cool that peer support is as early as the 1800s, and it's not just what we know today. A certified peer specialist became Medicaid billable in 2001, and their main focus is on supporting those with mental health challenges and help them maintain wellness, however wellness manifests to them. So again, it's about understanding harm reduction. It's about being there for the person and understanding what the person wants and how to get them thinking about what they want. A lot of folks who go to peer specialists for support were never given the opportunity to explore their wants. So a lot of what certified peer specialists have to do is coach their participants into that thought process, into opening up their mind and say, they're in control. They're in the driver's seat, as we like to say in New York. They have complete say of the services they want, they don't want, who they want providing the services. So that's something special about peer support in general, but I just wanted to bring that up for certified peers. So job expectations of a certified peer, they act as a role model for clients to prove mental health recovery is possible. They discuss shared lived experiences in a constructive and supportive way. They identify client needs and develop a recovery plan for those needs. They teach and encourage clients to practice self-advocacy and connect clients with community support and resources. So as for a certified peer, again, a lot of the major job components are being that support person, whatever that support needs to be regarding to, in reference to their participant wants and how they can best service them. So what's next regarding peer support? Peer supports for older adults. So why have the specialty? What would it even look like? And what programs, if any, are already out there? So some programs that are currently out there now. So Pennsylvania has a specific certified peer called the Certified Older Adult Peer Specialist, which trains folks to navigate what wellness means as you age. Broward County, Florida, has an agency called Silver Incorporated, which provides peer support outreach to their elderly population. New York State Office for the Aging has a program called the Senior Companion Program. Folks ages 55 and up can work with older adults on various non-clinical needs. And the Academy of Peer Services, which conducts the New York Certified Peer Specialist Training, has a specialty track now for older adult peers. So this is a newer thing that is coming in the peer support world. And it's important to remember or think about the needs as you age are different than when you were younger. And I'm going to talk about this in a little bit, but our demographic in the United States has been aging. So how can we as peer support specialists evolve with the demographic in the United States? So why have the specialty? As of this year, approximately 19% of the world's population is over 65 years old. Across the board, people are living longer, which also means people with mental health challenges are also living longer. MHA conducted a study which found that most geriatric health teams do not include mental health services. As the population ages, the comprehensiveness of service provisions needs to increase. So again, it's really important that peer support continues to stay relevant as those who need services ages and evolve in their life. And I think this is something really interesting and really cool that this is a newer thing that peer support is trying to adapt to. And it makes me hopeful that we're not going to have an end to our services or end to the support just because we're too old. And I think that the need is definitely there for our elderly people. And a big thing about peer support, remember that collaboration is key. So peer support, even though there are many different kinds of peer support, all have the same fundamentals. It's supporting the participant in a way that they express they need and in a way that they want. It's being there for their participant in a non-judgmental way and meeting them where they're at. All of these specialties, the biggest thing is meeting the person where they're at. So meeting a young person where they're at, navigating youth services, meeting a parent who's struggling with their child because they've never had any mental health challenges, meeting them where they're at. Certified peer specialist, a lot of people, me included, didn't know that these services even existed until my adulthood. So my first introduction to peer specialty was after my first crisis. So meeting that new individual where they're at. certified recovery peer, meeting that person who's ready to explore what sobriety means to them or what recovery means to them, meeting them where they are. All of these specialties in the peer support world create and sustain the peer support movement. I'm gonna stop sharing and, oh, that's not what I wanted to do. Can you all see me?
Yes.
Okay. So we have some time now for some questions, some concerns, some, question and answer time. If anybody has anything they want to mention.
Hi, I'm Darcel, and I'm from the Indiana and Illinois area. I live in Indiana and work in Illinois. And yeah, I work in a psych facility where we work from people from ground zero and to transition them back into the community.
Mm-hmm.
The things that I've seen with the peer recovery is more or less like a over promise and under deliver. Um, because you know my recommendation is when I transition a consumer to the community is that they have a therapist, a substance abuse counselor, and also a recovery support specialist. More or less, a recovery support specialist. At least try to see them at least 4 times a week. But I've
Okay.
noticed that a lot of times the ball is dropped because that person might not be that experienced with dealing with somebody with mental health issues because we're dealing with dual diagnosis. And I see a lot of the consumers return back to the facility because they're just not getting the services that they need. And so when you ask them about, well, what happened, and they might have an episode where they might be somewhat aggressive, and so at that point, that peer recovery support specialist will back off and kind of like not see them, and so they end up being depressed, non-medication compliant, and they end up back in the hospital and back to the facility again. And some of them don't even last, but anywhere from maybe 4 to 5 months at the most. And I think that they just need us, so you know, to get a little bit more experience, instead of just, okay, well, I've walked this walk before, but have you walked that walk with a person with dual diagnosis?
Right, and that's a problem I think across the board. Aviva had put in the chat that it's a big issue that we face here in New York and that we're actively trying to combat. We are pushing for those cross certifications for folks. So making sure that certified peers know that they can get the certified recovery peer advocate credential and showing them the value in having both so they have a better understanding on how to best support the whole individual.
Yes.
But it's definitely an issue that we see in New York as well. And it can be tricky. And I think I heard you say that you're having like a retention issue with the peer support specialists too. And I think offering them more peer workforce development opportunities would really help a lot of that. So showing them that there are different training programs that they get, the cross certifications help a lot too. So they have career expansion, having them be peer supervisors, right? If their agency allows it, showing them that that's possible. And it's not an easy fight to fight, but it's something that in New
Mm-hmm.
York we are advocating for pretty heavily, and it's been proven to keep peers in the workforce for longer.
Yeah. Yeah. Indiana offers another certificate along with the certified recovery support specialist for mental health, but Illinois doesn't do that. You just either CRSS or certified, and I was just fortunate because I am a MESA coordinator, so I deal with both dual diagnosis. So that kind of helped me out a lot.
Yeah, and I think that cross experience is really important too, to make sure that the peers not only know that they can develop, but feel comfortable in expanding their role. And
Yes.
that's why New York State has developed all of these different credentials because of the different niches that peer support can be in. We want to make sure that it grows with the individual and they stay, if
Yes.
they want to, in the field, supporting others.
Yes. Thank you.
You're welcome, and thank you for your question. Are there any other questions, comments?
I guess I had a comment. I was gonna say that I think it's a really good idea to have older peers. I really love that because Scott, who's also on this call, and I work for a warm line. And we have a lot of older folks calling in that are experiencing things like all of their friends being dead. And then they're talking to like a 20-year-old who's like, have you tried like a virtual support group? And they're like, I don't know how to use the internet. So I really
Right.
hope that that picks up some traction because that is really necessary with the amount of older folks that are isolated and don't know how to plug into like a virtual community. And
Yeah, and
that,
I think the best part about the peer workforce and peer support in general is that we meet the person where they are. So an older adult might not be able to access the internet. So then now we're thinking of ways, how can we reach them? How can we make peer support still relatable to their experiences now as somebody in their late 60s, early 70s? And I hope that it definitely gains traction. There is a specialty track for the New York certified peer that allows peer specialists to get into the older adult peer support. So I'm really hoping that since it just launched, that it does pick up steam because it is so needed.
yeah, that's so awesome. And then I just think about like how older folks sometimes don't like change with the times and they kind of need somebody who understands that to speak with. And like,
Yeah,
just like I'm queer, like it's fine. But like older folks sometimes don't get that like there's numerous genders and like they're gonna be thrown off by a question like that. And they kind of need somebody on their level to like be there with them through that confusion. But
right. And I completely agree and understand with what you're saying. They just their understanding of the world around them is so much different than somebody who's a youth peer advocate, right? Or somebody in their 20s, their understanding of the world. So having that person who's a little bit older, who has seen what they've seen and experienced similar life experiences and world experiences is going to be really helpful for older people to even want to find support, right? A lot of them drop out of mental health services because they feel it's no longer relevant. The providers get younger and younger and they get older and older, so there's the disconnect grows. And I think the older adult peer specialist is going to really work on closing that gap for sure.
On the other end of things, also, Laurie, I know you'd mentioned the focus for youth peer advocates on transition age or transition age youth, and I know we often talk about people sort of aging out of the system, out of the youth system. And it can be a very rough, sort of sudden transition when all of a sudden you hit that age and you're no longer with the same people supporting you and all of that. Can you talk like a little bit more about that gap and how we can make the transition a little bit smoother and less awkward and abrupt?
Yeah, definitely. So that's exactly what youth peer advocacy aims to do. We youth peer advocates do service children ages 12 and up, but it's really meant for folks that are in that transition age from 16 to 25, figuring out how to be an adult. What does that look like? What does that mean? How to pay a bill, how to live independently. And youth
I'm
peer
still
advocates
trying to figure
come.
that out.
Me too. um, and they really aim to try to support them in a way that they might not have. Be that natural support in an environment where they might not have those natural supports. Because we all need that extra guidance, and some of us aren't as fortunate to have consistent parents or have consistent guardians or family members or anything like that that can say, "Hey, this is how you pay a bill, and this is how you register for things," and This is how even they could do things like this is how you buy a car, or think about, do you even want a car, right? How do you find a doctor? That's the biggest one that that's the biggest issue young people face, is finding providers. What does that even look like as an adult? And youth peer advocates are young enough to still relate to the struggle that their participants have, but have enough experience to say, hey, this is the way. So they really aim to close that gap. But if that's it for everybody, thank you so much for coming to my workshop.